For this presentation, I decided to look at the treatment of pediatric cases of bipolar disorder. When evaluating the topic of whether or not to give children mood stabilizers and antipsychotics when treating this disorder, my standpoint with this is to not give children medication. This concept will further be developed by looking at information presented in peer-reviewed studies and videos by authority figures in the field. When first discussing this concept, it is vital to understand the basis of bipolar disorder. According to the lecture found in Module 3, the traditional medicine route is the use of antipsychotics. This includes varying generations, some that are dopamine antagonists, serotonin agonists, which show relief for symptoms. However, it's vital to point out that there are many side effects with this type of medication, such as mental confusion and sedation properties. When evaluating the use of medication, the documentary watched pointed out that medication should not be used as a first line of defense when treating children. Bipolar disorder is rare in children, and time again, many children are misdiagnosed with this disorder. This is due to the fact that many children are treated by their pediatrician and individuals that are not specialized in diagnosing children with bipolar disorder. Plus, there is not a very clear line between a child having bipolar disorder or a child experiencing childhood stress. As pointed out by Dr. Thomas L. Matthews, he believes that there should be other treatment methods tried out before medication is prescribed. In this case, there could be issues in terms of drug interactions. With this, different drugs could be used for different purposes, and dependent on the individual, could have different purposes or outcomes. For instance, Benadryl is known for being a sedative. However, for individuals experiencing a high enough dosage, this could be used as an anti-anxiety medication. Additionally, genetics is vital. If a medication was given to a parent or someone else in the family and it didn't help said person, then doctors try to steer away from giving that same medication to the child. Additionally, a study done by Smarty and Feinling showed that the idea that sometimes children have multiple mental disorders that they are dealing with at one time. Once, for example, ADHD is dealt with and medication is given, this could help alleviate symptoms for the child, but giving them more medication could hinder them, and there's not enough data to support that there's any true impact with the combination theory. Therefore, the idea of the combination theory may not be as beneficial as individuals may hope for it to be. Another study done by Siripi and Arnold expanded on the idea that children are not commonly studied population, which makes it harder to medicate them. For instance, researchers use the example of preschoolers. Preschoolers are considered orphans in the terms of the scientific community because they are not analyzed when studies are conducted. It's difficult for researchers to include this population because they are minors, and minors require parental consent but also additional protection. It's also important to mention the findings done by Thomas Feinling. They highlight the fact that children's medications are only studied with adults concerning adults. The lack of overall study done with children in terms of prescribing them antipsychotics should be worrisome for the population that want to medicate these children. Additionally, the study went through the different medications that are commonly used to treat bipolar disorder in reference to adult versus children, and it highlights that while medication may help an adult, there's a lack of research in terms of the efficacy and safety for children. When wrapping up, whether or not children should not be given treatment for bipolar disorder, the conclusion remains that giving medicine is not a supported idea. A study done by Berger and Hellman followed the idea that the early intervention may be the best way to help these children that may be experiencing bipolar disorder. With this early identification, a child can get the proper treatment that they need before symptoms develop and help to avoid the medication route. Here are my citations. Thank you.